We continue with kidney, a Zhang organ. The kidney is related to the bone and marrow in body constituent and shines in the hair. Governing the bones and generating the marrow are an important component of the function of kidney essence in promoting growth and development. Marrow includes bone marrow, spinal cord, and brain, which are derived from the kidney essence. The growth and development of bones depends upon the enrichment of the bone. Bone cavity is full of bone marrow if the kidney essence is sufficient. It is solid and strong if fully nourished by bone marrow. If the kidney essence is insufficient, the production of bone marrow will be reduced. Thus, insufficiency of bone marrow cannot nourish the bone fully, and a malnourished and poor bone is developed, which is soft and weak. In infants, it is characterized by late closure of the fontanelle and soft, weak bones. In adults, aching and weakness of the lower back, knees, and lassitude, and in old people, fragile and weak bone. These symptoms are often treated clinically by tonifying the kidney and supplementing the essence. The strength and growth of teeth also depends on the kidney essence, which is known as the teeth being the surplus of the bone. If the kidney essence is sufficient, teeth will be solid and strong. If the kidney essence is insufficient, teeth will be loose and will be lost in a younger age. The development and maintenance of the spinal cord and brain are also related to kidney essence. The brain is called the sea of marrow because the spinal cord is connected with the brain and forms the brain after it merges into the brain. The function of the brain is to govern the spirit, which depends on the nourishment of the kidney essence. If the kidney essence is sufficient, so will the brain, which is characterized by good energy, better vision, and hearings, as well as quacking thinking ability. If the kidney essence is insufficient, the production of brain marrow will be reduced, leading to various pathological changes, such as low spirit, lassitude, tinnitus, dizziness, retarded thinking, pain in the lower back and knees. Hair is also called the extension of blood, and it depends on blood for nourishment. Therefore, it is said that the hair is the extension of blood. Hair's life mechanism originates from the kidney. The kidney stores essence, and the essence can turn into blood. Therefore, it is said that the kidney reflects its brilliance on hair. The growth, loss, moistening, and withering of hair are related to kidney essence. In young and middle-aged people, kidney essence is sufficient and blood is plentiful, so hair will appear lustrous. In old age, kidney essence is insufficient, so hair will appear gray or white and begins to thin. Even for young and middle-aged people, this may happen if kidney essence is insufficient. The kidney opens into the ears and two lower in parts. The hearing ability also relies on the kidney essence. If kidney essence is sufficient, the sea of marrow is nourished, and the ears will have good hearing ability. If kidney essence is insufficient, the marrow will be deficient, and the ears will become weak, leading to symptoms such as decreased hearing, tinnitus, and even deafness. Old people tend to be poor in hearing because the kidney essence declines naturally as they grow old. The two lower in parts of the body refer to the anterior and posterior genital areas. The anterior genitalia govern the functions of urine excretion and birth giving, while the posterior genitalia govern the function of stool expelling. Although urine is discharged from the bladder, urination depends upon the steaming and transformation function of the kidney. Hence, urination disorders such as frequent urination, enuresis, oliguria, or urodialysis are often related to kidney dysfunction. As to the relationship between the kidney and the reproductive function, nothing will be added to what have been stated. Although the removal of feces is controlled by the large intestine, spleen, and stomach, it is also related to the Qi transformation of the kidney. The deficiency of kidney yin may cause the intestinal fluid to dry up, leading to constipation. The deficiency of kidney yang can lead to constipation caused by yang deficiency, failing to produce yin. It can also lead to diarrhea due to the cold spleen, as well as the accumulation of water and dampness. The weak kidney may also result in loose stools over a long period or incontinence. C, the kidney corresponds to fear in emotion. Fear is an emotional reaction to a fearful situation. Kidney corresponds to fear in emotion. Excess fear may injure the kidney and make it weak, which result in the incontinence of urine and feces, premature ejaculation, and miscarriage. Sputum is the fluid of the kidney. Sputum in the mouth belongs to fluid. The thicker part of the sputum belongs to kidney, while the thinner part belongs to the spleen. TCM believes that sputum is transformed from the kidney essence. Therefore, swallowing it without spitting out can nourish the kidney essence. If too much sputum is spitted out, it will damage the kidney essence. Ancient experts who practiced the Taoyin Kung Fu would prop the tip of the tongue against the palate till the saliva became full in the mouth, then swallow it to nourish the kidney essence. Patients with kidney deficiency or kidney coldness will often spit out sputum. Thank you for your attention.
Now let's talk about earache. With the exception of qi and blood stagnation, earache is usually due to heat. This can be an invasion of wind heat affecting the lesser yang channels, which is very common in children, and damp heat in the liver and gallbladder channel or liver fire. A yellow discharge from the ear may accompany an invasion of wind heat or damp heat in the liver and gallbladder. The earache from qi and blood stagnation is not common and is usually seen only in the elderly. When the earache is due to wind heat and lesser yang channels, there's aversion to cold and fever. Damp heat and gallbladder, there is ear discharge. With liver fire, there's headache, red face, bitter taste in the mouth. For qi and blood stagnation, there's chronic earache, especially in the elderly. Earache with acute onset, aversion to cold, that is due to invasion of wind heat. There will be aversion to cold, fever, sore throat, headache, body aches, slight sweating, tongue with red sides and or front with floating rapid pulse. The acupuncture points are LI4, triple burner 5, bladder 12, lung 7, and triple burner 17. For damp heat in the gallbladder, there will be earache, yellow discharge from the ear, dizziness, tinnitus, hypochondrial pain, fullness and distension, nausea, vomiting, inability to digest fats, yellow complexion and eyes, irritability, feeling of heaviness, unilateral or bilateral, thick, sticky yellow coating, and slippery, rapid pulse. The acupuncture points are gallbladder 43, triple burner 5, Ren 12, Ren 9, spleen 9, triple burner 17, and gallbladder 2. For liver fire, there will be earache with sudden onset, worse with pressure, headaches, dizziness, red face, bloodshot eyes, thirst, bitter taste, tinnitus, irritability, propensity to outbursts of anger, constipation, dark urine. There's red tongue with redder sides and dry yellow coating with a wiry rapid pulse. When there's stagnation of qi and stasis of blood, there's severe earache, headache, tinnitus, purple tongue, and wiry pulse. For a clinical note, the chronic earache in children is always due to a residual pathogenic factor, usually damp heat, after repeated upper respiratory or ear infections that are usually treated with antibiotics. Thank you so much for your attention.
Let's proceed to diagnosis according to the 5 phases with 2 phase dominating patterns. In these imbalances, the controlling phase dominates the phase that succeeds it in the cruise cycle. There will be signs and symptoms that the controlling phase is excess and the controlled phase is deficiency. These patterns will be treated by draining qi from the phase that dominates the succeeding phase in the cruise cycle. For example, if the metal phase dominates the wood phase, the metal phase sun's point, which is lung 5, is drained. The deficient phase can be tonified via its mother point, in this case, liver 8. Wood dominates earth. This pattern corresponds to the Sanko imbalance of liver qi invading the spleen. The symptoms and signs are as follows: abdominal bloating, hypochondriac pain or distension, irritability, loose stools, poor appetite, nausea, greenish tinge to the complexion, headache, flatulence, fatigue, full pulse in the left gland position and a weak pulse in the right gland position. For the acupuncture treatment, the liver's fire point, which is liver 2, is drained and the speen's fire point, spleen 2, is tonified. Now let's have earth dominates water. This pattern is similar to an accumulation of fluids due to kidney and spleen yang deficiency. The symptoms and signs are edema, lack of thirst, difficult or frequent urination, a yellowish face, cold limbs, fatigue. The right gun pulse position is full and the right sure position is weak. For the acupuncture treatment, the spleen's metal point, which is spleen 5, is drained, and the kidney's metal point, which is kidney 7, is tonified. Next pattern, water dominates fire. This pattern is similar to the Zanko patterns of heart and kidney yang deficiency, overflowing water. Here are the symptoms and signs. Edema of the ankles and legs, aversion to cold, lumbar soreness, dizziness, palpitations, cough with watery sputum, slight breathlessness, weak pulse in the left soon position, full pulse in the left sure position. Acupuncture treatment, the kidney's wood point, which is kidney 1, is drained, and the heart's wood point, which is heart 9, is tonified. Next pattern, fire dominates metal. This pattern corresponds to the Sang-Fu pattern of lung heat or lung phlegm heat. The symptoms and signs, loud cough with yellowish sticky sputum, fever, or an aversion to heat. There's thirst, red face, a full pulse in the left soon position, and a weak pulse at the right soon position. The acupuncture treatment, the heart's earth point, which is heart 7, is drained, and the lung's earth point, which is lung 9, is tonified. Next pattern, metal dominates wood. This pattern corresponds to the Zanko pattern, lung and liver qi stagnation. For the symptoms and signs, there will be fatigue, irritability, hypochondriac tension or chest oppression, dyspnea, cough, white face, a weak pulse on the left gun position, and a full pulse on the right shun position. Acupuncture treatment, the metal's water point, which is lung 5, is drained, and the liver's water point, which is liver 8, is tonified. Thank you for your attention.
Okay. Diagnosis according to 4 levels. Ying level, part 2. Observation of the tongue is important when differentiating between pathogenic heat in the Qi level and the Ying level. This is because the tongue will show that the extreme heat has damaged yin. The thick and yellowish coating, which is characteristic of Qi level heat, has vanished, and the tongue body proper is much more red in color. There can be signs of false cold. This will manifest with icy extremities while the person's torso is burning hot. This is due to the extreme heat binding Qi, so it does not reach the hands and feet. Theology, exposure to exogenous pathogenic Qi that is penetrated down to the Ying level from the Wei or Qi level. Symptoms and signs, fever that worsens at night, insomnia, restlessness, dry mouth but no thirst, petechiae, red skin rashes, unconsciousness or coma, delirium, raving, the skin of the torso feels hot but the hands and feet are icy cold, dark red tongue without coating, fast, deep, fine pulse. Key symptoms, fever that is worst at night, dry mouth but no thirst, red tongue without coating, rapid and fine pulse. Treatment principle, drain heat from the Ying level and nourish yin, possibly restore consciousness. We can choose from the following acupuncture points: P3, P8, P9, do 14, do 26, kidney 6, spleen 10, bladder 40. Needle technique, draining, microbleed, P9, do 26, and bladder 40. P3, P8, and P9 drain heat from the pericardium. Do 26 restores consciousness. Do 14 drains heat. UB40 and spleen 10 drain blood heat. Kidney 6 nourishes yin. Patients with these conditions will probably be in treatment with Western medicine. Ying level heat can be caused by Wei level heat and Qi level heat and can result in blood level heat. Thank you for your attention.
For treatment principles, let's talk about season and timing. Treatment in accordance with person, locale, and seasonal conditions. In the process of treating an illness, it is important for the physician to adjust appropriately to the season, the weather, geographic locale, and the characteristics of the patient's body, such as its constitution, gender, and age. From the holistic point of view, the body exists in nature and is therefore subject to influence by the many elements of nature. The seasonal and the locale must influence the development, progression, and resolution of illness. Moreover, differences in the body's constitution generate differences in its equilibrium of yin-yang and qi and blood. The same illness will manifest and develop differently at different seasons and times, in different locales, and with different bodily characteristics. Hence, a concrete illness requires concrete analysis with emphasis on the unique circumstances when formulating treatment. The treatment approach and choice of treatment and medications for any illness must take into account the characteristics of the season and the weather, as well as the timing. For adjustment to season and weather, in general, in spring and summer, the weather is warm or hot and yang qi is ascendant. The skin and the superficies are accordingly in a relaxed state, and the pores are loose and open. If exogenous wind or cold attacks a patient, the normal treatment is to release the exterior. But in spring and summer, it is important not to overuse exterior releasing herbs that are acrid and warm, since doing so can lead to excessive dissipation and damage to yin qi. In autumn and winter, as the weather changes from cool to cold, yin is ascendant and yang becomes weaker. The skin and the superficies accordingly tighten up and the pores close, so that the body's yang qi submerges to the interior. In such a circumstance, unless the patient suffers an illness with very high fever, it is proper to avoid herbs that are of cold or cool nature, as these may injure yang. Chinese medicine has the guiding principles of when applying cold, distance from cold, and when applying heat, distance from heat. Not adjusting to the season and weather can lead to systematic complications, since the season and weather affect the practical choice of therapeutic approach in herbs. For example, illnesses of summer heat are strongly seasonal and are often joined with dampness. Thus, when treating illnesses in summer, it is important to pay attention to cooling summer heat and dissipating dampness. In autumn, the weather tends to be very dry, so most exogenous illnesses include dryness. When prescribing drugs, it is important to avoid including too much of fragrant, warming, and drying herbs, and to favor acrid, cooling, and moistening herbs. From the perspective of the harmony between heaven and the humans, the movement of the body's qi blood and yin-yang have regular rhythms, and there is a definite relationship between the abnormal changes of illness and the cycle of day-night. When treating an illness, the physician should attempt to choose the best hour to administer the drugs. Thus, on the basis of empirical observations, the ancient physicians formulated a number of maxims. For example, warm kidney yang in the morning and augment spleen qi in the evening, or nourish kidney yin in the morning and strengthen spleen qi at noon, and strengthen kidney qi in the morning and nourish kidney yin in the evening. Modern medical studies have confirmed that importance of this adjustment. The same medicine taken at different hours may have different effects. Adjusting treatment to the diurnal changes of the body's yin-yang sometimes have even greater clinical significance than adjusting to the season and weather. For adjustment to locale, as China has a vast territory encompassing a large variety of geographical and geological environments. As the local environments vary, so do the pathogenic agents and circumstances, so that each locale has its characteristic pattern of common illnesses. The same illness occurring in different environments requires different treatment because of differences in the climate and the body's responses to the environment and also the patient's personal habits. For example, in the northwestern region of China, the climate is cold. Most illnesses are due to cold in the exterior and heat in the interior. So the treatment should emphasize dispelling cold from the exterior and cooling heat in the interior. In the southeast region, the climate is warm. Yang qi leaks to the exterior and endogenous cold can develop readily, so that the often treatment should emphasize astringing yang qi and warming the interior. Thank you so much for your attention.
Let's now proceed to diagnosis according to Zhang organ patterns with the pattern spleen-yang deficiency. Spleen-yang deficiency is often a development of spleen-qi deficiency, but it can be the consequence of other imbalances. The symptoms and signs that define this pattern are very similar to those seen when there is spleen-qi deficiency. There will, though, also be signs of deficiency code in this pattern. An excessive consumption of cold or cooling food and beverages, both in their temperature and energy, the consumption of antibiotics, and repeated invasion of dampness and cold in the middle jaw can all damage spleen yang. Spleen Yang will also be adversely affected by living or working in a cold and humid climate. Spleen Yang deficiency and kidney Yang deficiency are often seen together, and one will often lead to the generation of the other. In the end, it becomes difficult to determine which is the root cause. For its symptoms and signs, there will be fatigue, loose stools or watery stools containing undigested food, cold arms and legs, poor appetite, bloating after meals, craving for sweet flavors, preference for warm food and beverages, or a pronounced aversion to cold drinks and salads. There will be a pale face, desire to lie down, a poor posture, aversion to cold, tendency to wrap their arms around themselves in an attempt to keep warm, can be dressed in warmer clothes than other people, cold limbs, weakness or fatigue in the arms and legs, edema, tendency to put on weight, flatulence that is not odorous, pale, swollen, and wet tongue, possibly with teeth marks on the sides, a deep, weak pulse, especially on the right gland position. The key symptoms: fatigue, loose stools, aversion to cold, cold limbs, and a weak pulse. Treatment principle: tonify and warm spleen yang. For the acupuncture points, we can choose from stomach 36, spleen 3, spleen 6, REN 6, REN 12, UB20, and UB21. Needle technique is tonifying. Moxa is also recommended. Stomach 36, spleen 3, spleen 6, REN 6, REN 12, UB20, and UB21 all tonify spleen yang. The advice given for spleen yang deficiency is the same as that given for spleen Qi deficiency. When there is spleen yang deficiency, it is even more important that the person avoids food, beverages, and drugs that are cold in their energy or temperature, as well as consuming things that have a warming energy, such as cinnamon, ginger, cloves, lamb, and so on. Spleen yang deficiency can be caused by spleen Qi deficiency, kidney yang deficiency, and invasions of damp cold. In turn, it can result to spleen Qi sinking, spleen Qi not holding blood inside the vessels, kidney yang deficiency, food stagnation, damp cold, phlegm, blood deficiency, lung Qi deficiency, heart Qi deficiency, and heart yang deficiency. To recap, spleen yang deficiency can be due to prolonged exposure to damp, excessive consumption of cold and raw foods, which hinders spleen, irregular eating and eating too much, excessive mental activity, and chronic illness. Underlying or accompanying pathology: spleen Qi deficiency, lung Qi deficiency, and kidney yang deficiency. Signs and symptoms: there will be poor appetite, slight abdominal distension after food, bright white complexion, tiredness, weakness of limbs, loose stools, tendency to weight gain, feeling cold, cold limbs, edema, fatigue, spirit, physical cold, abdominal pain relieved by warmth and pressure, diarrhea containing untransformed food. The pulse is weak, deep, slow, and forceless. The tongue is pale, swollen, and wet with white coating. Treatment principle: fortify and warm spleen yang and disinhibit water. Acupuncture treatment: we can use REN 12 to fortify the stomach and spleen. Spleen 3, the source point of the spleen. Bladder 20 supplements the spleen Qi in chronic condition. Spleen 9 resolves damp in the lower burner. Bladder 22 supplements the spleen and resolves edema. REN 6 warms the lower burner. Stomach 22 regulates the intestines. Stomach 36 supplements spleen Qi. Spleen 6 supplements spleen Qi. Bladder 21 supplements the stomach and spleen Qi. REN 9 supplements spleen and resolves edema. Stomach 28 supplements spleen and resolves edema. REN 11 harmonizes the middle burner, and REN 4 supplements Qi and Yang with needle with supplementation and large amounts of moxa. Thank you for your attention.
We continue with phlegm, diagnosis according to Genie imbalances. A person with a lot of phlegm will have difficulty concentrating. There is a difference in how a difficulty in concentrating manifests itself in various imbalance patterns. When there is heat, the person will find it hard to concentrate because they are mentally and physically very restless. New thoughts and ideas will constantly arise, which makes it hard for them to remain focused. When there is heart blood deficiency and spleen Qi deficiency, Shen will lack nourishment, resulting in the mind feeling empty. When they read something, they cannot remember what they have just read. When there is phlegm, it is hard to concentrate because the head feels as if it is full of cotton wool, and the thoughts are very blurred. It is difficult to think clearly. Again, this can be recognized from when you have had a heavy cold or a bad hangover. Due to its obstructive nature, phlegm can also be a cause of dizziness. The difference between dizziness in a deficient condition and phlegm is that when there is phlegm, there will also be a heavy sensation in the head and possibly even nausea. Moreover, the dizziness can arise completely at random, and it often feels as if the room is spinning round. The dizziness will often feel worse when the person is lying down, or lying down will not ameliorate the condition. Physically, phlegm can be seen in a person's skin and the flesh below, which appears dough-like and lacks tone. This can sometimes be seen in the face. The complexion will be pasty and the skin slightly loose. There may be a lack of luster to the skin. The skin and the hair can also be greasy or oily. There can be a tendency to be slightly overweight or even obese. The person may be stocky and portly without being muscular. The fingers of a person with chronic phlegm may be a little too thick and appear to be slightly chubby. There can be increased growth of body hair. Phlegm, because it blocks the movement of blood, can manifest with a dark, sooty color around the eyes. A person with phlegm can sometimes have a special odor. The odor is difficult to describe precisely, but it is easily recognizable when it has been smelled a couple of times. The smell is heavy and lingers in the air a long time after the person has left the room. It can sometimes smell a bit like a wet leather jacket. The saliva in the mouth will be thicker and stickier. The person can have a sticky taste or sensation in their mouth. Phlegm can also manifest with a gravelly voice, a slightly nasal quality to the voice, or the need to clear the throat a lot. The tongue can be swollen or lacking in tone and can have an oily or sticky coating. The pulse is usually wiry or slippery. Symptoms and signs that are triggered or provoked by perfume, petrol, or solvents will be due to phlegm dampness. This is because phlegm has a heavy and greasy nature. The above substances dissolve and dilute things that are oily, and they will dissolve and dilute phlegm in the body. This will result in the phlegm that was previously stagnant and embedded in the body's tissues being set in motion and circulating around the body. Although this dilutes the phlegm, it still has a disrupting and obstructive effect. Phlegm dampness can also be provoked by scents and odors that are heavy, such as certain perfumes and flowers such as hyacinths and lilies. Phlegm dampness symptoms are also often provoked by weather fronts, especially when there is low pressure, thundery weather, and very humid weather. Symptoms that are exacerbated by consuming phlegm or damp-producing food and drinks will, of course, also indicate that there is phlegm. Looking through the symptoms and signs can give the impression that we and most of our clients have phlegm. This is not far from the truth. Both the climate and diet in Northern Europe mean that there can be a tendency to develop phlegm dampness. But phlegm is also something that accumulates throughout life and is often a consequence of most chronic patterns of imbalance. Therefore, the older you get, the more phlegm we'll probably have in your body. Thank you so much for listening.
Let's talk about blood stasis in intestines, spleen, and stomach deficiency. The clinical manifestations of blood stasis in the intestines are chronic diarrhea, blood in the stools, abdominal pain that is worse on pressure, and the tongue will be purple and the pulse is wiry or firm, often wiry on both rear positions. The treatment principle is to move qi and invigorate blood. The points to choose from are spleen 4, pericardium 6, liver 3, spleen 10, kidney 14, stomach 25, bladder 25, stomach 37, and stomach 39 with an even method. The spleen 4 and pericardium 6 regulate the penetrating vessel and invigorate blood in the intestines. Liver 3 and spleen 10 invigorate blood in the lower abdomen. Kidney 14 is a point of the penetrating vessel which invigorates blood. Stomach 25 and bladder 25 are the front collecting and back transporting points of the large intestine and regulate the intestines and stop diarrhea. Stomach 37 and stomach 39 regulate the intestines, stop diarrhea, and stop abdominal pain. The spleen and stomach deficiency clinical manifestations are loose stools, sometimes like water, thin stools, sometimes with mucus, an increased frequency of bowel movement, poor appetite, slight abdominal distension, a feeling of oppression of the chest, a sallow complexion, and tiredness. The tongue will be pale and will have teeth marks. The pulse will be weak. The treatment principle is to strengthen the spleen and benefit the stomach. The points are REN 12, bladder 20, bladder 21, stomach 36, spleen 6, REN 6, stomach 25, stomach 37, do 20 with the reinforcing method. The REN 12 and bladder 20, bladder 21, stomach 36, and spleen 6 tonify stomach and spleen. REN 6 tonifies Qi. Moxa and ginger on this point is the best method for intestinal problems from a deficient and full spleen. The stomach 25 and stomach 37 stop diarrhea, and do 20 raises spleen Qi and helps to stop diarrhea. Let's look at this case history of a 37-year-old man who had been suffering from diarrhea for 5 years. His stools were always loose and occasionally like water. He was often very tired and his head felt muzzy. His pulse was very weak on the right side and his tongue was pale and swollen. The diagnosis is a clear case of spleen Qi deficiency with some dampness and phlegm. It is dampness and phlegm in the head that caused it to feel muzzy. The treatment principle used was to tonify spleen Qi and resolve dampness. This patient was treated with acupuncture and a patent remedy. The main acupuncture points used with the reinforcing method were stomach 36, spleen 6, bladder 20, bladder 21, REN 12 to tonify stomach and spleen, and stomach 25 and REN 6 with moxa on ginger to tonify Qi and stop diarrhea. And stomach 37 for the lower C point of the large intestine is specific to stop chronic diarrhea. Thank you so much for your attention.